My name is Theresa and I live in Rhode Island, but I am a patient of the PRM New York office in Great Neck and a patient of the PRM Dallas office. In terms of conditions that I had been struggling with before coming to PRM, I had officially been diagnosed with endometriosis 3 years ago via a laparoscopic excision surgery. So I did know that I had endometriosis before coming to PRM. However, my symptoms had been getting worse. From the time of my first period at 12 years old, I knew that I wasn't getting a period the same way as everyone else. I suffered with debilitating cramps that would cause me to miss school, would cause me to miss sporting events and practices. And honestly, I would bleed through my clothes. It was kind of embarrassing for me. I would get really bad migraines, awful fatigue, and that continued, my whole life. I went to college and things started getting worse. I was getting really bad back pain and leg pain. As I got older, painful intercourse, nerve pain. I was getting polyps and cysts. I was put on birth control to help manage the pain of being a woman at 16. But really, before coming to PRM, what had happened was the minor relief that I had had since my first surgery was completely gone, and things had progressed really badly. I was experiencing leg numbness and tingling. My hips were freezing. On imaging, it was looking as if I was having a lot of issues with my spine and my back and my joints, even stenosis, which really is just inflammation in your joints and your nerves. And I was really debilitated, to be honest, and doing my best to just survive. I was on continuous hormones, so I wasn't getting a period at that point when I came to PRM, which I think was the only thing saving me. Some of the symptoms that impacted my life the worst were the leg numbness and the tingling, which I now know was nerve related. There were mornings where I couldn't get out of bed. I don't know, it almost felt like sleep paralysis where, when your arm goes numb when you're sleeping, except this would happen to my legs and my hips, and my husband would have to actually help me out of bed. Or I'd be on a run at the gym, just walking on an incline even, and my legs would go numb, my feet would go numb. The bloating and the just general unease in my abdominal area started getting worse. My clothes weren't fitting, except my weight wasn't changing. And those symptoms were all familiar to me from just living in my body for 20 plus years. But I started to just convince myself that there's no way it could be endo because it had been only 3 years since my surgery, and how could this be happening? And I started getting a little bit anxious. I was put on anxiety medication, and for the first time I actually accepted it, as opposed to thinking that the doctor was wrong for assuming that it was anxiety. I started to get depressed and a little bit pulled back in my marriage, because the painful intercourse was becoming so bad that I would bleed during and after. And so I became, almost afraid of intercourse. And honestly, mentally, it was just a challenge every day for me to exist in that body. Prior to my first surgery, I had 12 different doctors that I went to trying to explore this. My first doctor that I ever saw told me that I was too young for endometriosis when I had asked about it, because my mom has endometriosis. So I flat out asked him. He told me the pain was part of being a woman. My second OBGYN that I ever saw as an adult, when I was complaining to her that I was bleeding while running, bleeding, all the time for no reason, asked me if I'd been raped. Told me that maybe that was why. It turns out that I had a ton of polyps, and I learned that through a very painful, in-office type of ultrasound where they shoot saline. I was crying. I had to have a procedure to remove it. I had probably 7 colonoscopies before coming to PRM. 2 of them happened after my surgery because I kept having bowel symptoms and I kept insisting that I was bleeding when I was having bowel movements, and I kept being told that that was in my head. I kept insisting that I was having blood in my urine and I was having urine issues and issues with my bladder, and I was told that was in my head. Asking me like how I first heard about PRM is kind of like a trick question, right? Like I said, I had had surgery before, I had done physical therapy, I had really put in the work. And I had been documenting that, experience on social media, on the internet, trying to advocate for patients like me, which is kind of how I ended up working at PRM. So I'm kind of a unique story, I think. But what I think is kind of unorthodox, I guess, is that I didn't think it was endo. No matter how educated I was on the nerves and the muscles or anything, I just thought there's no way endo can be back. Like, how can it be this bad? Because my first surgeon told me that it wasn't that bad. She said that a lot of my lesions were superficial, and my first surgery was only 30 minutes. My husband still to this day describes it as dropping your car off for an oil change because it was COVID and he couldn't come with me. And so even though Dr. Alley kept encouraging me, through discussions and through her clinical expertise that the PRM protocol would help me, I just felt like there's too many patients that need this and I need to focus on my job and I can't spend time, worrying about myself. But then the nerve pain got worse and I started doing research and I started exploring, could it be pelvic congestion syndrome? Could it be anything? And I just kept getting more images and getting more dead ends and having more providers tell me that I was crazy and that it was in my head and there's no way it could be endo. And I felt like, how is it possible that I have a diagnosis and I'm still getting gaslit? How is it possible that I have confirmed endometriosis and I'm still being told that I don't know what I'm talking about when it comes to my own body? And so I thought, there's nowhere else I can go. There's nowhere else I'll be believed. There's nowhere else I'll be validated. And there's nowhere else that knows endometriosis besides PRM. And so I sent all my images to PRM, all my history to PRM, and I decided that I would travel back and forth to New York from Rhode Island to do the prehab PRM protocol in Great Neck. And that if I did need surgery, I would fly to Dallas for it. And so after reviewing my history, reviewing my images, and getting that internal exam, it was decided that I needed surgery, that it was nerve involvement, bowel involvement. And I just said, you know what? The pain is too high. I'm in 12 out of 10 pain all the time. Let's do this. I know it's going to work, and the data says it's going to work, so let's do this. When I decided to get surgery the second time, it all happened really quickly. I think I had about 6 weeks between when I decided to explore PRM as a second option and opinion and when I scheduled the surgery. And so with that in mind, I said to my surgeon, do you want me to do the PRM protocol as prehab or post-hab? Obviously, working here, I knew that it was an option and I wasn't sure, most patients do both, but what was mine? And my surgeon said, both, if you can. You know that it's a better outcome. And so I decided to do 2 treatments a week for 3 weeks to kind of maximize the amount of time that I had going back and forth to New York. And so I, got all my appointments scheduled in Great Neck and just started driving back and forth. I did make lifestyle changes in terms of the fact that I started moving more towards an anti-inflammatory diet again, as I had kind of fallen off that wagon a bit and got to this mental state of like, who cares? And I did the PRM protocol, as well as just started changing my exercise a little bit. I stopped running and was doing more incline walking because of the hip pain. And I started doing some gentle suppositories for muscle relaxing. My symptoms at that point were very bad. And I would say through the series of 6 treatments, it was fascinating for me to understand how my pain levels were changing and understand like where my nerves and muscles were impacted. If you're going to go through a surgery and you know that endometriosis is something that is involved with your chronic pelvic pain, or if it's not and you just have chronic pelvic pain in general, I would say for me, I think the most shocking part was knowing that it wouldn't cause me immediate relief, but seeing like the progression. Like by the third treatment, I would say I was shocked that I was feeling relief. I was not in as much pain every day, and my muscles like felt different, if that makes sense. And for someone who'd been in pain for 20 years, I still to this day, I'm like, wow, that's pretty weird. I would say my pain levels got probably to like an 7 or 8 out of 10 even before surgery, which I hadn't reported that in years. So like I mentioned, I flew to Dallas for surgery, to the PRM Dallas office, and I had my surgery at Texas Presbyterian. I cannot say enough good things about how PRM treated me during the surgery. I truly felt like it was a white glove treatment. Comparing it to my first surgery, like completely night and day. I can't, like, I sometimes get a little bit emotional when I talk about it to anybody because it was a way more complicated surgery than I even could have imagined. And I was experiencing, I think, a lot of PTSD from the first surgery because it was a very bad experience for me. I had infections in my stitches after the first surgery. I never saw my surgeon again after the first surgery. And she, even after the first surgery, when I did go to her like virtually for a follow-up, was pretty dismissive with me. And they had found, you know, precancerous cells and things like that in my first surgery. And even with that, she was pretty dismissive. And so I knew that that wouldn't happen at PRM, but it doesn't change the fact that like when you've lived those experiences, you're still pretty anxious. So I had a laparoscopic excision of endo. We knew that the plan going in was also going to be an operative hysteroscopy, and we knew we were going to look at my tubes and just make sure that everything was good with my fallopian tubes. What I didn't expect when I woke up was that I was also going to find out I had an appendectomy because my appendix was resting on my pelvic sidewall. And then also I had a uterine septum that had to be removed, which explained so much of the symptoms I had had my whole life that had been dismissed, you know, pain with intercourse. I couldn't wear tampons, they would fall out, bleeding with like anything. I had a CT scan once where I was having pelvic pain and they couldn't find my appendix. And so I think I laugh about that now because it's like, yeah, you couldn't find it because it wasn't where it was supposed to be. So there was endo on my hypergastric nerve, on my ureters, on my uterosacral ligaments, deep infiltrating in my colon, my rectum, on my bowel, my pelvis, all over the left side, which my prior surgeon said there wasn't any there. And luckily, the, you know, experience and the skills of the surgeon at PRM, I didn't have to have a bowel resection or anything crazy like that. And what was even crazier was that, yeah, I woke up in excruciating pain. I just had surgery. But within 24 hours, I was walking. That did not happen after my first surgery. I mean, my whole family noticed it. They were like, one, you look like you lost weight. No, my body's just not inflamed anymore. And two, how can you be walking? Like, how is this possible? And it was because I believe, you know, the PRM protocol made the surgical recovery process easier. It made my body stronger, but also like the surgery was just so much better, and the skills involved, even though it was such a complex surgery where I was in the OR for so long and in recovery for so long, the surgery itself was a much better surgery. I think the first surgery I had, I was really focused on like getting back to the gym, getting back to my life, not appearing weak. PRM doesn't want you to feel that way, and they are very cognizant of like talking to you and following up with you and making sure you know that like this is a journey and this is something you're going to manage for your lifetime with their support, which I think was really reassuring. You know, my surgeon followed up with me so much that night of surgery. The next day, the hospital was calling me, PRM directly was calling me. Everyone was kind of checking in and making sure that things were as they should be. And if anything seemed weird, anything seemed abnormal, I had no concerns about following up with PRM, which was so reassuring that I had that kind of support. 6 weeks after surgery, I was back in the PRM office in Great Neck, getting evaluated, having my incisions looked at, and I did decide to do post-tab in terms of another round of the PRM protocol. And that wasn't because I was in severe pain or anything. I actually was shocked every day that I woke up without pain. It was more like I knew that doing the PRM protocol post-operatively would prolong the successful impact of that surgery. And so I wanted to make sure that I was giving my nerves and my muscles a fighting chance after understanding like that there was such deep endo and that my nerves were involved and that it was so deep into my muscles and that I had to sacrifice the uterosacral ligament, which I say that, but like, what does that even mean really? Just knowing that like my ureters were involved, that like there was bladder involvement, there was bowel involvement, that there was the septum, like, I mean, giving the PRM protocol another round meant that I was decreasing my inflammation again. I've also since then started pelvic floor physical therapy here in Rhode Island, and that's been incredibly helpful. And honestly, my pain level, like when I went for my 6-week follow-up at PRM, I reported 0 out of 10, which I've never reported in my whole life. Sometimes I'm like, is this even real? Like, it's kind of crazy. I'm still tired all the time, but I mean, I think that's going to take a while. I've been able to run more. I can drive without back pain. I can stand without back pain. My clothes fit differently. I'm not bloated all the time. And if I am, it's because I ate a bag of candy. My quality of life has just gone up. I mean, even like my colleagues at work have noticed that like I have more energy and my like focus at work is better. And I think I didn't realize that like I was spending so much of my mental energy focused on masking how much pain I was in. What would I say to someone considering PRM? You know, looking back, I think about all of the doctors I saw. I often joke, all the doctors I loved before. I think about all of the imaging I've had done, all of the tests I've had done, all the times I was put under anesthesia, and the over-the-counter medicines I've tried, the yoga I've tried, the vitamins, so many vitamins, the books I've read. And none of it worked. Some of it gave me some relief. There's some vitamins I still take. Some of it gave me, 6 months of relief, an hour of relief, but none of it really worked until I found PRM. And so if I was like talking to someone right now who, even if they didn't have endo, they had any kind of chronic pain, I would say, just think about that for a minute. Think about everything you've tried that didn't work, and realize that this is going to work. There's data and clinical research that says it's going to work, but also like you're going to meet a provider for probably the first time in your whole life that's going to listen to you and is going to validate you and is going to believe you, which that's also never happened to me until PRM. And they are going to work with you to help you not live in pain all the time. And I think that's been the most valuable part of my treatment overall, is that like, yes, my pain levels are at 0 out of 10 and they were at 12 out of 10 before. But when something happens, because this is a lifetime disease, it's never going away, it's endometriosis, it's chronic. Say I'm having a pain flare or I'm a little bloated or constipated, I know that I have like someone at PRM I can go to talk to. And I also know that it's not in my head, like it's real and it's there. And I have the tools and resources to solve it. So like, that's the thing that is so different and so beautiful that I want all patients to think about when they're considering and starting their journey, is that there's someone here who will believe you and validate you and tell you it's not in your head. the heavy bleeding, the chronic pain, the constipation, it's all real. It's not in your head. And there's something here that's going to fix it.